5-year-old Tucker is about to have major surgery to fix a torn ligament.
So here's your knee, and here's your kneecap going down like this. That's the ligament that holds it in. And your ACL is right here. So this just gets torn right in the middle. So those pieces are just causing pain inside the knee there and don't need to be there. We remove them, and then we're going to place a band. So the band is very strong and should be solid in the knee, and we won't have to worry about it again. They can actually live with these in place for the rest of their lives. So I've probably done about 10 or 15 ACL surgeries here since graduating vet school, usually with some assistance. It is a complicated surgery. You're working with a joint, you know, there's a lot of attachments and structures in there that you have to be careful of. So it is definitely nice to have Jeff around.
My whole career has been about teaching people, in all honesty. I think all vets should be able to do knees. It's just so common, you know? And surgery just isn't that difficult once you kind of get a few thousand under your belt. You start to feel comfortable with any kind of surgery. That's the thing about surgery. As you do surgery, you just get better at surgery. It doesn't matter what kind of surgery it is. Need a hand or not? You all right?
No, not yet.
The more proximal part, I always separate that.
All right. Jeff has so much knowledge. It's always nice to ask him some questions if I need to.
I've done over 165,000 surgeries at this point in my career. Learned from a few good people, you know. I say I've never met a vet I couldn't learn something from. Never met a vet I couldn't teach something to.
Now that she's opened up Tucker's knee, Dr. Amy can remove the torn part of his ligament.
I definitely think my skill level has raised since being here. You know, we get to do so much.
She's not afraid to learn things. That's the whole point. The mere fact that she is interested in doing soft tissue and bone surgeries is very impressive.
Doing fine, I would say. So far, getting ready to start placing the band now.
Dr. Amy will insert a synthetic band to mimic what the ligament does inside the knee.
So this is the band. It's just like a nylon wire. This top anchor here is above the knee. Now I'm going to make a hole in the bone below the knee to thread this through, and that will be the two spots that hold it in place. So this is how I'm passing it through, using this needle with the hole in it, and that pulls it right through. I'm just making sure it's got normal range of motion. One thing that's hard is making sure you place that right, so I might have Jeff check that. You want to check and make sure?
Sure.
I guess I should have maybe, I don't know, maybe I shouldn't have